This is Chew on Health, and I'm your host, Dr. Joe Chew, and I get to interview health experts in various fields to answer your most burning health-related questions. To submit yours, simply go to chewonhealth@gmail.com, and that is spelled CHIU on health@gmail.com. Let's get straight to today's question. Okay, welcome back to the show. And once again, we have Dr. Vitaly Mozeson with us, one of our expert health practitioners. And Doc, welcome back.
Thank you. Thanks for having me back, Joe.
Absolutely. So today, I wanted to ask you a question that I'm sure you've been asked many, many times before in your clinic, but for those who are listening, I think that they'll get a lot out of this as well. Now, in the past, we had talked about the type of therapy that you had came up with called disc restoration therapy, and specifically for spinal decompression, patients with low back pain, sciatica, things like that. And so what I wanted you to I guess, explain to our listeners is really how does that type of therapy, the disc restoration therapy, how does that heal or help heal damaged spinal discs?
Yeah. So the answer to that would probably be twofold. The primary thing that the disc restoration therapy method does is it negative pressure within a damaged disc. Now, throughout the day when you're sitting, standing, or even laying, you have some sort of positive pressure on the disc that causes that disc to wear out and not function as well as it should. So when you're undergoing disc restoration therapy, what it does is it creates a negative pressure within that disc, and that negative pressure allows for the disc to start absorbing the fluids, nutrition, and oxygen that it needs to stay healthy and tall. The other thing that happens is when you're undergoing disc restoration therapy, you are getting pulled in a logarithmic rhythm. So as opposed to traction that kind of holds and pulls, what disc restoration therapy does is it kind of pumps the disc. And being that the disc has no circulation that goes to it, it relies on its internal natural pump mechanism, where when the disc is damaged, that pump mechanism is disabled. So what it does is it's basically, like I say, it's a defibrillator for the disc's pump mechanism and gets that reactivated so the disc could start working. Now, with that negative pressure, what also happens is if there's a herniation or a disc bulge, that negative pressure will actually suck that herniation or that bulge disc material back in and off of the nerve that's causing all the pain. So those are kind of the three ways that disc restoration therapy will heal a bulge disc.
Okay, excellent. And how many times or how many treatments will you start to see some results in a patient?
Yeah, so actually to go through the whole kind of healing process to actually fix the disc, you have to allow for one treatment to build on the other. And most of the studies, most of the protocols within our clinic, they're based on around a 20 to 27 session protocol done over about an 8-week period. And that's where one treatment can build on the other. The weight will ramp up slightly, and you'll spend more time on the table as you progress. So it's kind of a progressive treatment, but you'll probably start feeling some sort of relief, some sort of results. I would say most people feel after the first maybe 4 weeks.
Okay.
You'll start to feel a reduction in symptoms. You could stand longer. You could do more exercise, play with your grandkids longer, whatever it may be.
Wow, 4 weeks. That's tremendous.
Yeah. It's pretty good.
Yeah, and I love the explanation of how you differentiated the DRT method versus the traditional traction method, because I think that's what a lot of people think that spinal decompression is. But as you said, that it clearly is not. It's a logarithmic type of pulling traction.
It is. Yeah, and there are many other ways. There are also many other ways that it is different, and we could touch on it in another call, or we could touch on it now. But there are several, I guess while we're talking about it, I could tell you about it now. There are several differences, huge differences between spinal decompression and traction. So on top of that logarithmic pull where you're kind of ramping up and then releasing, what it also does is you're able to program the actual disc level that needs the attention. So you actually get
Wait, let me back that up.
Angle.
Let me back that up. So let's say in the lumbar spine, traditionally you have 5 segments. So you're saying that you can actually specify which segment, L1, 2, 3, 4, 5, according
Yeah.
to the pathology and the treatment.
Right. Right. Yeah.
Oh,
So
wow.
based
Okay.
on the MRI, and the X-ray, you could actually pinpoint which disc is damaged based on your images, and then from there, there's actually a way to program the table so it concentrates the majority of the pull in that area. So the angle at L4, L5 is much different than, let's say, L1, L2. And that way, your whole spine isn't just being contraction, but it's focusing everything on that one area. And I guess the biggest key difference is that the decompression table that we own has a feedback system. So that feedback system will actually feel if there's any muscle tension or muscle fighting or muscle spasm. And what it does, it creates these micro adjustments where it kind of tricks the muscles into relaxing.
Okay.
So the actual decompression can happen within the disc, because that's what it's all about. Not getting your muscles pulled, but getting that negative pressure within the disc. And if your muscles are too tight, it's just not going to happen. And that's what happens with regular traction. Big difference.
I think that's a game changer right there. Just that specificity that the DRT system allows. I think that right there is a big difference. So
Sure
thank
is.
you for explaining that. And I guess if some of our viewers want to learn a little bit more, would they just go to your website, which is drtmethod.com?
Correct. Yeah, that's where they can learn about the 5 steps. That's where they could get our contact information and learn more about the process.
Perfect. Thank you so much, Doc. And until next
Got
time,
it.
We'll see you soon.
Thanks for having me back. Take
You
care.
bet.
Bye.
Thank you for listening to Chew on Health. To get your question answered, email us at chewonhealth@gmail.com. And to find out more about our health expert, go to the show notes, or you can visit us at chewonhealth.com. And until next time, cheers to your health and wellness.